mic is awesome. Okay. We don't know the actors. Yvette, Elijah, what is it? The love of Christ constraineth us? What is that? I need you. I'm mixing AY and Pathfinders. It is? Okay, loving the Lord Jesus is what? That is message to all the world in this generation. Okay. Motto?
Pledge. From love from God above to show the world we care. I've been to you. I've been to you. I've been to you. We from every land and sea. Together we pray, work and play. Happy harmony we have a faith to share with others everywhere. A message from love from God above to show the world we care. I've been to you. I've been to you. I've been to you.
All right, so we're going to get started on our program. Oh, poor pumpkin. We have my cousin, Dr. Katrina Heath, from the Queen City of Charlotte, North Carolina. She is a doctor of physical therapy, and she has been in practice for over 23 years. And her specialty is women's health and dysfunction. You know I'll make it up. Pelvic health. So today, how many people in here have a pelvic floor? Everybody has a pelvic floor. How many know where the pelvic floor is? At the bottom? What's the bottom? Your toes? Okay, so if you don't know, that is fine because you didn't learn this in biology school or anatomy or anything. So you're going to learn all of this. How many people have heard of urinary incontinence? What about urinary urgency? What about fecal urgency? Okay. What about sexual pain? Okay. So all of that is about the pelvic floor. So without further ado, before I start making up facts, I will present to you my cousin, Dr. Katrina Heath.
Thank you all. It's so funny. Everybody migrated towards the right of the sanctuary. So I said, well, do I need to just move on over? So I think I will. So, because I want to be on the same side. I want to be on the winning side today. Not in the center, but on the winning side. So thank you all so much for coming. I really appreciate everybody who has come out. We are going to begin with prayer because I can't do one thing without God. Amen? Amen. All right, so if you can, please bow your heads at this time. God, we thank you for each person who is here. God, we just come before you, first of all, just saying thank you for the Sabbath, thank you for time to rest, and thank you for time to understand what wonderful bodies you have given us and how beautifully you have created us. And so, Lord, I pray that everything that I say will be made plain and clear to the people who are here to hear this and those who are online, those who may hear this in weeks to come. Lord, may this be a blessing to everyone who hears. And I pray, God, that your spirit will come in and help me to be able to articulate things in the way in which they will understand and convey the message that you have given me. So thank you again for this opportunity. And now I pray, Holy Spirit, come in, empty me of myself, and fill me up with you. I love you in Jesus' name. Amen. All right. So how many of you were here? I can't believe it's been over a year since I was here the last time. It was in December of 2024. You were here for that. Anybody else? One other two, three, four, five? Okay. So a few of you were here before. And how many of you were able to put to practice the things that we talked about? Okay. I see 1, 2. Okay. So hopefully today you'll be able to pick up some other things and be able to learn some different things as we move forward. So today we're going to talk about pelvic health matters and what your body may be trying to tell you. So I want you in this presentation to, if you see yourself, I want you to think, should I be talking to somebody about this? And if I should it be a pelvic floor therapist? Should it be my doctor? Should it be my primary care or my OBGYN, my urologist, my pediatrician? It may be all of the above, right? But we don't need to be ashamed of the things that take place in our bodies. Why? Because God made our bodies, and we are all fearfully and come on, y'all better know the word at Immanuel Temple. So here we are. I'm going to move to the next slide, and this talks about me. Who am I? My cousin just came up and gave a brief introduction, but I am a physical therapist. I've been a therapist now for 23 years. I still can't believe that. Been a pelvic floor physical therapist for 19 years, almost 20 years, and I love serving this population. God gave me this gift to be able to talk to different people about their pelvic floor, and I absolutely love it. Some of the things that I love to do is I love God. I love my family. Those are my 2 boys up there. My husband, who's in the back, drove me all the way up here from Charlotte. And I love my friends. I love to sing. I love to lead worship at church. And I love to talk, okay? I'm sorry, I do. I love to talk about and educate. We're related? Okay. I love to educate people specifically about their pelvic floor because a lot of people think that they know about the pelvic floor, and some do, but then there's so much to learn, and you will hear that today as I move through this presentation. So we talked about what a pelvic floor is just a little bit. Natalie just asked the question, where is the pelvic floor? Somebody said, in the bottom. In the bottom of what? What is this thing called up here on the screen? Does anybody know? What is this with the bony structure? It's called your pelvis, okay? The base of your pelvis, you have a pelvic floor. Children, boys, girls, all of you. Women, men, we all have a pelvic floor. The pelvic floor is connected from your pubic bone in the front. That's the hard bone that sits at the base of your pelvis, and it is connected to your coccyx bone or your tailbone in the back. All the red muscles, let me have one of you come on up, yeah. You're going to display this, walk down the aisle, and just let them see. The red part of this structure is called your pelvic floor. And it helps us to be able to control things, right? We hold things in. Somebody might want to hold it. You can allow them to hold it if you want to. Yeah. And it holds things in, right? But it also needs to be able to relax and let things what? Out. And when there's an imbalance there, that's when you have the dysfunction, okay? So pelvic floor dysfunction is a term that we use to describe multiple disorders. It's not just one thing, right? It's multiple, and we're going to talk about what those are. But that happens as a result of our pelvic muscles and ligaments being impaired. So you are not alone. You are not alone. Can you see yourself up here? Men, women, children, they all have different issues. Some of them, which are bowel dysfunction, that's a type of pelvic floor dysfunction, okay? Bladder issues, sexual health concerns, as well as pelvic pain. And so I want to talk about this because it's very common and it's treatable, okay? So don't think I have these issues, I'm gonna have to suffer by myself. No, you don't. 4 signs that your body is telling you that you need help, okay? If you have urgency or frequency, how many of you know what urgency or frequency is? I see 1 hand, 2 hands. We have another microphone. Yes. I would like for this young lady here to answer me. What is urgency? And then someone else raise their hand. What is frequency? Urgency. No? I think it was her. Yes, it was. What is urgency? What does that mean?
Urgency is when every time you look around, you have to use the bathroom.
Every time you look around.
And there is no waiting period.
Exactly.
When you gotta go,
you gotta go right now.
you gotta go.
That's it. Remember that song? I gotta go, I gotta go, I gotta go right now. That is urgency, okay? And that is a type of pelvic floor dysfunction. These, again, are signs that your body is telling you you might need help. Frequency. How many of you know what that is? Frequency. Oh, in the back. Yes. Exactly. So how many of you know how many times you should be going to the bathroom in a 24-hour period? Education time. We should be going to pee. How many times should you empty your bladder in a 24-hour period? 3 times? Somebody said 3, somebody said 4. Haven't heard it yet. Somebody said 10. As many times as you intake liquid. Okay, so I'm gonna give it to you. Research says we should be going between 5 to 8 times within a 24-hour period. If we are going more than 8 times, you have urinary frequency. More than 8 times in a 24-hour period, you have urinary frequency. And that means your body is telling you, hey, I need help in this area, okay? I don't know how many people, you don't have to put your hand up, but if you have experienced this, or you know someone who is experiencing it,
I'm healed now.
you're healed. Okay, all right. The things that I'm going to teach you really help, okay? So, and even if I don't get to everything today, very hard to try to do everything on pelvic floor dysfunction in an hour. It's really hard to do that. But I'm gonna give you as much as I can. So other things that your body, other signs that your body is asking for help, pelvic pain. Pelvic pain, we'll talk about that in a little bit. Leakage, that means I cough, I sneeze, I pee, or I think I have to go to the bathroom and I can't get there fast enough and a little bit might trickle out here and there. That's considered leakage. Even postpartum, some moms cough, sneeze, pee, bend over to pick up their children or doing laundry and bending over and then boom. You're like, wait a minute, what just happened? Okay, don't listen to people telling you, oh, that's just a part of life. You're just getting older. It's gonna happen. It can happen, right? You're not broken, but it can be treated, okay? And then there's sexual health issues that we will talk about as well. So don't feel like you have to suffer in silence. So, women, men, children deal with pelvic floor issues, correct? Yes. All right, we're gonna start with the men. And I'm doing this specifically because a lot of people feel like this is only a female problem. Matter of fact, when I started off with this, it was called women's health. And everybody talked about women's health, but what about the men? Men have pelvic floors too. So we're gonna start talking about some statistics with men. And the first one is 10% of men report urgency and frequency over the age of 65. So if we have 100 men in this room over the age of 65, 10 out of that 100 are probably having issues with urgency and frequency. And they're not talking about it at all because this is just not the thing that men want to discuss, okay? Same idea, and this all came from Mayo Clinic. 3 to 10% experience leakage of urine with prevalence rising up to 19% in some studies by the year 2020. That means if 100 men are in a room, somewhere between 3 to 19 of those men are having issues with what? Urinary leakage, okay? 16% of men have chronic pelvic pain. That means that they are having issues with sitting. We'll talk about some of that in a little bit. But they may have problems with intercourse. They may have problems with their prostate, and they're not talking about it. 14% of men have symptoms of leakage 5 years after they have their prostate removed. If they have prostate cancer, 5 years later, 14% of them still have issues in that area. And then look at this number, 80% of men who are status post a prostatectomy, 80% have erectile dysfunction, which is a sexual health issue, and urinary incontinence. How many of you knew that? That's huge. That's a huge percentage, right? So again, you're not alone if you're having these problems. Men, what does pelvic floor dysfunction look like? Okay? I'm gonna name some of these things. If you are having these issues, don't necessarily raise your hand because I don't want to put you on Front Street, but I want you to think. I hear the men laughing. What might I be dealing with, and when is my body telling me I need to go and get some help or seek some help? So here it is: penile, scrotal, perineal, or anal pain, okay? This is not just growing pain. Sometimes people say, oh, I'm having pain in my growing area. This is specific to penile, scrotal, perineal, or anal pain. Erectile dysfunction. Again, 60% of men over the age of 50 deal with erectile dysfunction. These are some other pelvic health symptoms, pelvic symptoms. Tailbone pain, pain interfering with sitting or exercise. If you always see people who are walking, who are standing, take note. If it's your husband, if it's your son, if it's someone who you love, your father, do they ever sit down? And if they don't sit down, why? Is it because they're having pain when they sit? Pain in the prostate? Are they having issues with exercise, right? Are they having pelvic pain when they exercise, and so they don't exercise because it causes too much pain? Are they having urgency, frequency, hesitancy? Do they have decreased urinary stream? So I used to go to the bathroom and I peed for 8 seconds, 10 seconds, right? And it's a straight stream. Now all of a sudden, I reach the age of 50, 55, 60, 70, and that stream starts to do what? Decrease a little bit, right? It's slowing down. I'm not getting the 8 to 10 seconds straight anymore. Now it's like 2 seconds, and then there's a little rest period, and then maybe 2 or 3 more seconds, right? And so that hesitancy is there. Constipation, which is huge, right? If you are constipated, more than likely, you're gonna have issues with your bladder. And the reason is because, where's that pelvis? The rectum sits right behind the bladder. I don't even know if you can see it in here, but the rectum literally sits right behind the bladder. And if the rectum is full, it's gonna do what? It's gonna push against that bladder and makes you feel like you need to go to the bathroom. And sometimes you do, and sometimes you don't, right? So the first thing that we need to do if you have urinary symptoms is think about what's happening in your rectum. Are you constipated? The next thing is growing pain. So that is pain in between the pubic bone, so where your thigh is, where your thigh meets or the femur bone meets your pelvis. So it's gonna be more in this area. That is true growing pain. But a lot of men, they say they have growing pain and they're not having pain in that area. Usually it's testicular, scrotal, or anal or rectal. SI joint dysfunction. How many of you have heard of that? That's that low back pain, okay? It can present in that way as well. We're gonna move to the next slide, which talks about male pelvic symptoms as well. This is something we probably have not heard about, pudendal neuralgia. That is where there's a nerve inside of the sacral nerve root actually goes out into the pelvic floor, and it causes pain in that nerve. So that's why it's called neuralgia. But the pudendal nerve is the nerve that innervates the pelvic floor. Chronic non-bacterial prostatitis. This is huge amongst men. especially if they're seeing urologists. So these are the people who have prostatitis and they think that it's bacterial, but it's really not. So they keep giving these men antibiotics over and over again. And a lot of these men have been on antibiotics for months, sometimes even years. And the problem is not clearing up. The reason the problem is not clearing up is because it's not a bacterial infection, it's a pelvic floor dysfunction. And if your doctor is not necessarily well versed in that, or they're not referring you to a pelvic floor therapist, then guess what's gonna happen? You're gonna keep walking around with that same problem. So I just wanna educate you to know, if you keep hearing the term prostatitis and I have a bacterial infection and I'm on antibiotics, think this might not necessarily be a bacterial issue, okay? Next thing is painful bladder syndrome, or you may have heard of it as interstitial cystitis. That is another term for people who have a lot of pelvic pain. They go and have a lot of urgency and frequency, and they've been to the doctor several times. Again, they're put on antibiotics for months. And so sometimes, yes, that helps, but a lot of times, if they don't address the musculoskeletal issues, it's not going to resolve the problem. And here's the last one I want to talk about for men. It's called, well, actually two. So one is irritable bowel syndrome, you've probably heard of, and then persistent genital arousal disorder. So PGAD, which is that persistent genital arousal disorder, I didn't even find out about this until I was a pelvic floor therapist. I was like, what in the world is happening here? So this is where your pelvic floor, the nerves that innervate the pelvic floor, is on steroids, that's what I call it, because they continue to fire so much that you're constantly in the state of arousal, always. So it can happen with women as well as men. I mean, you turn your head, you're washing dishes in the kitchen, and you're having orgasms. You are going down the street, going down the steps, it's just orgasm after orgasm after orgasm, and pretty soon, that can get very fatiguing for people. So most of my patients who would come in with this would be zombied out. Why? Because their doctors have put them on the heaviest medications to try to control the nerves. So their gabapentin is like 3,200 milligrams, 6,400, whatever it is, milligrams. It's so high, and they're literally walking like a zombie. They don't want to move fast. They don't want to move, at all. They don't want to walk. They don't want to do anything because they're always in this state. So it can happen to men as well as women. So if you've never heard of it, now you know. If you happen to see someone who has that issue. So we're gonna move on to the females. All right. Any questions so far about the men? Oh, there's one. Any questions? Oh, I thought you raised your hand. No? Okay. We're gonna move on to the women. So 1 in 3 women, if we had 3 ladies, boom, 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 1 in 3 women have urinary leakage. That's the statistic, okay? That's pretty high. 25 to 33% of women suffer with pelvic floor dysfunction, and that can, again, include frequency, urgency, leakage, pain, but it's not limited to these. However, after menopause, all of this increases. Welcome to menopause, ladies. Yes. So, pelvic floor dysfunction in women can look like urinary disorders, which we just talked about. So, incontinence is one of them, urgency, frequency, overactive bladder. It can look like constipation. Think about irritable bowel syndrome. So, sometimes with irritable bowel syndrome, you may have a propensity towards chronic constipation, and then sometimes towards diarrhea. So, that's IBS-C, IBS-D. Then it can also look like prenatal and pregnancy postpartum pain, or leakage, or urgency, right? People who have just had a baby and they may have had an episiotomy. They may have had vaginal tearing during pregnancy. So a lot of times these things happen with women. I also wanted to point out with pelvic pain, because that also is a pelvic floor dysfunction, we may have symptoms of endometriosis. How many of you know what endometriosis is? Okay? Yes. And so with endo, a lot of times we have painful cycles. So I want to talk about, because we have some girls in here today, I'm not sure if they have started their cycle or not, but when you start your cycle and you're having pain, and this pain is causing you to have to miss days out of school, or you're in the floor rolling over, got hot water bottles and heating pads and all the things, I want you to think about telling your parents or your guardians, hey, I think I need to see my pediatrician about this, because it could be endometriosis. I'm gonna tell you my personal story. I was 9 years old when I got my cycle. 9. I had so much pelvic pain on my cycle, and I went to the doctors, everything, did not even find out I had endometriosis until I was in my 40s. That's a long time to be dealing with that type of pain. So what I'm saying is, if this is happening to people who you know, talk to the nurses at school, talk to your children, talk to your pediatrician, let them know, hey, my daughter might need to be checked for this or whatever. I just want to make sure that we're educated when it comes to that. Pelvic pain also can include, I'm going to come right to you, fibroids, as well as pelvic organ prolapse. And pelvic organ prolapse happens when there is the uterus or the bladder or the rectum comes through the vaginal vault. Okay? That's called a prolapse. Yes, she has a question. Yes, thank you.
So a lot of times you may report these painful periods and they'll do like an ultrasound which cannot detect endometriosis. Is there a specific verbiage that you recommend that these younger women or girls can, force a doctor to do the proper examinations for endometriosis?
Yeah, so there's only one test really that can detect endometriosis, and that is if they do a laparoscopic surgery, to be able to go in with the camera to see what exactly is going on. So what I would do in that case is talk to the doctor, tell them what the symptoms are. There are certain medications that they can give to the kids. There's also certain dietary restrictions that will make it better, a little bit better. So, and we're gonna talk about it when we get to the teen section. But specifically, that's the only test that I know that's the gold standard to find out whether or not you have endometriosis, is to do a lap. And so doctors don't want to do that. Why? Because it costs money. Yeah. And so they're going to be like, no, 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 no. But what you can do is ask them, is there something that can be done, whether it's medication? A lot of times, and I'm very cautious about what I want to put someone on, one of my loved ones. I don't have any daughters, but if I did, the first thing that they're going to tell you is, there it is. So, and that's the only thing that I know that has helped calm people, their endometriosis down, is putting them on hormones. But I know for a lot of kids, girls specifically, if you adjust their diet, you get them exercising, you limit how much milk and sugar and salt intake that they have, especially around that time, you can reduce it. I also tell even some of my adult women to start taking ibuprofen before, and I can't tell everybody this because y'all not all my patients or whatever, and I don't really prescribe medicines to my patients, but I'll tell them to ask their doctors if you can take the anti-inflammatories before the cycle comes. So if you know your cycle is coming on the 28th, you need to start taking medication on the 24th and let it build up in your system, along with all the things that we talked about, stretches and all those things. We can get into that later, but if they do that, usually it will reduce the amount of pain that they're having at that time. Does that answer your question? Okay. Anybody else have any questions before we continue to move on? That was a great question. Thank you. So that is what pelvic floor dysfunction looks like in women. Now we're going to talk about kids. Woo! Y'all not exempt from this. Let me tell you. So here's some of the statistics for kids. Approximately 1 in 7. So if we have 7 kids in here lined up in a row, 1 in 7 usually has some type of pelvic floor dysfunction. Can you tell me what the primary pelvic floor dysfunction you think is? Bedwetting? No more? Yes, who said it? Somebody said it. Constipation is the #1 thing for kids, okay? Constipation, urinary incontinence, that means a lot of times, sometimes if the kids are laughing and then they pee on themselves and they're like, they call it giggle incontinence. And it happens to a lot of these children. 5 to 15% struggle with daytime or nighttime urinary incontinence. So nighttime urinary incontinence is bedwetting, yep. So what does pelvic floor dysfunction look like in children and teens? Again, constipation, urinary incontinence, urgency, frequency. Doesn't this sound very familiar? Bedwetting and pelvic pain. Again, with our menstrual cycles, we have to really think about it, that when we're having, and I kind of went over it a little bit when I was answering your question, but kids, you all need to make sure when you do come on your cycles at whatever point, whether you're 9, 10, 11, 12, and I will say, if they have not started their cycle by 17, that's when you get a little bit like concerned. If they're over the age of 17 and haven't started their cycle, then you need to seek a pediatrician. But other than that, they are fine. Even if their peers are coming on and they come to you saying, Mommy, I haven't started my cycle yet, my friend got hers, da-da-da-da-da. It doesn't matter until they reach the age of 17. If they're over 17, then yes, let's talk to the doctor about that. Any questions so far about what pelvic dysfunction looks like in kids? Because we're gonna get into a little bit of bedwetting. I think bedwetting is something that a lot of people don't talk about for sure, and don't want to talk about it because it's embarrassing. Yet the parents get very upset with these kids when they are wetting the bed. And they're like, but Mom, I can't help it. And you're like, well, I'm gonna whip you so you can. That is not how we're supposed to handle that situation. That literally is a pelvic floor dysfunction, okay? So, do we beat ourselves up when we cough and sneeze and pee? No. It's not something that we're trying to do. It's just something that happens. Yes, you have a question again. Only because some people online want to hear.
Enuresis and encopresis are not only pelvic floor dysfunctions. It could be because of trauma, mental health concerns too.
Exactly. Thank you. And I actually have that in my slide. But enuresis is bedwetting. Encopresis is when you are pooping your pants and you don't really want to. Okay? Yeah. So here we go with nocturnal enuresis. There's primary and then there's secondary. So primary is when a child has never had urinary control at night. They've never had it. Secondary is we had control, and then after about 6 months or so, they had control for at least 6 months. After that, they lost it again. They may have had control for 2 years. Then all of a sudden, they start wetting the bed again. And it's like, well, what just happened, right? So 20% still have a problem with bedwetting at age 5. It keeps getting lower. 10% still have a problem at age 7. This is when they will usually come and see a pelvic floor therapist if they are over the age of 7, okay? I've had some kids younger than 7, but typically we try to wait until around 7 because then they can really understand why they're there and they can help with their own exercises. Then we have 1 to 3% who still have that problem within their late teens, teen years. They're still having bedwetting issues. So, bedwetting risk factors. What are some reasons why these kids may be having a problem? 1, constipation. Again, we talk about it, the big C, constipation. Obstructive sleep apnea, snoring, diabetes, okay? ADHD medications can also cause this. Kidney and bladder disease, these are all risk factors. Again, with your bladder, at nighttime, there's sometimes less space in the bladder at night. Kidney, more urine is made at night, so if you have kidney problems, again, that's happening at night. And then sometimes your brain will even tell you, I can't wake up. Like, it's very hard for them to wake up, so they're in such a deep sleep. And so genetics plays a role in this. Stress, like you said, plays a role in this. Trauma can play a role in this. When people have had continence and then all of a sudden they go through something that is very traumatic and then they revert back. So it's not up to us to get mad and get an attitude and put them on punishment, but we do need to have some type of understanding that this is going on, and maybe again, if they're over the age of 7, they need to come see a pelvic floor physical therapist. Any questions about that? All right, we're gonna move on to bedwetting treatment. What do you think the first thing that we need to do? We talked about this. What's the first thing to manage? Thank you. So with bedwetting, I'm gonna always address that first. So people are like, but I don't have any problems in that area. I'm like, really? You don't? I came to you because of urinary issues, not my bowels. It all works together. It's all in the same area. And again, if this is impacted, if your colon is impacted, your rectum is impacted, it's gonna push against that bladder and it's gonna make you go to the bathroom when you don't want to. So we're gonna start with treating constipation. We're gonna move to relaxation, which a lot of times people think, oh, we're gonna go straight to Kegels. That means we're gonna do what? We're gonna do all these contractions and everything. A lot of times these kids need to learn how to relax their pelvic floor. They don't need to contract it. And even with adults, sometimes when we're having leakage problems, everybody wants to run to do the Kegels. And I'm like, no, we need to work on reversing the Kegels because we're so stressed that pelvic floor is so tight. When you go to try to do a Kegel, it has nowhere to go. Your pelvic floor can't move in anymore until it learns how to relax. Once it learns how to relax and let go, then you can do a proper Kegel contraction. But most people, that's what the doctors tell you. If you're leaking, go do some Kegels. So with bedwetting, we want to make sure that we teach them how to relax their pelvic floor. Then we work on strengthening the pelvic floor with doing contractions. We use biofeedback. We might use electrical stimulation. A lot of times doctors will put them on something called imipramine or desmopressin, which are medications to help control urinary incontinence or urgency. And they'll usually give it to them for a short period of time, especially if they're going on overnight stays somewhere and they don't want to wet the bed. Doctors will give them this just to take so that they don't have that issue when they go to camp or when they go to grandma's house or wherever. Dietary restrictions, again, we talked about reducing salt, sugar, caffeine. How many of you the kids like sugar? Candy. Yes, that is a huge one. You do too? Yep. So we have to reduce that if you have problems with bedwetting. And then we think about putting people on a voiding schedule. That means they're going to the bathroom every 2 to 3 hours, okay? You're not waking them up in the middle of the night 2 to 3 times. This is during the daytime because your body needs to get into the habit of using the bathroom. A lot of times kids practice something called withholding, which means they won't go. And they'll do everything in their might not to go. Like you'll see kids crossing their legs, they tighten up their bottoms and they're walking. I mean, there's all kind of crazy things, but that's the way that they've always handled stress or trauma and things like that. And so we have to teach them how to relax, and it's okay to go to the bathroom. You're not gonna miss anything, right? Oh, but my friends are playing and they're doing this and that. And I'm like, no, you gotta go to the bathroom. And sometimes there's a alarm that you can give kids, like a vibratory watch. These kids who have bedwetting issues can get on an IEP in school so that their teachers know that they need to go to the bathroom. You know, sometimes kids will like, no, my teacher didn't let me go to the bathroom. No, you need to talk to the teacher and let them know. I have had to do it for my own child. And I'm like, no, we're not going through that. If he needs to go to the bathroom, he needs to go. Like, so, but there's a watch you can order on Amazon, a vibratory watch, to try and help them to remember to go to the bathroom when they're in school and outside of your care. The other thing is called a MOPS protocol. There's a doctor called Steve Hodges out of Greensboro. I think he is out of Greensboro, Winston-Salem. But he wrote a book on the MOPS protocol. If you all have any issues with bedwetting, this is one of the protocols to follow, okay? Dr. Steve Hodges. So, how is your poop?
Amen.
We talked about constipation. Most people think, I go to the bathroom every single day, so I'm not constipated. And I'm like, how do you know? What does your poop look like? Take a picture of it. Better yet, just look at it. Make sure you see what's going on, okay? Type 1 poops are very hard, lumpy. They look like little small nuts. That is not what you want. That's a constipated poop all day. Number 2, sausage shaped but lumpy, okay? So it's still long, but it's sausage shaped and it's lumpy. That's still a constipated poop, even though you may be pooping every day, okay? We want to shoot for type 3 and type 4. That's a normal poop. 5, 6, and 7, you need to add some more fiber to your diet. 7 is just like liquid. That's like diarrhea, right? So you definitely don't want that. So there should be shapes to your poops, but make sure that they are not like type 1 and type 2, okay? So again, this doesn't go just for children. This is for adults as well. If you're having problems with your urine and your urinary urgency or frequency, you got a question?
No,
Oh.
I can't quite see what mine does up there.
Oh. I need you to get your phone out. Go ahead and take it, blow it up.
I gotta make sure.
Yes. But you can also Google this, Bristol stool chart on Amazon, or you can look at it on Google and make sure that you are aware of what's going on. So we talked about making sure we reduce constipation, because constipation is a very popular, I should say, one of the highest bowel dysfunctions that's out there. So how do we treat constipation? So this talks, and how do we treat withholding as well? So we're gonna talk about breathing. I want everybody to sit up. I want you to take a deep breath in, and then exhale. When you breathe in, tell me what's happening to your belly and your chest. So put one hand on your belly, one hand on your chest, breathe in, exhale. So tell me what's happening to your chest, what's happening to your belly. Is your belly moving? Is your chest moving? Which one is moving more? Somebody. Both are moving, okay? Both are contracting and expanding. Now, I want you to try this. Do it again. Tell me which one is contracting more. Which one moves more, belly or chest? Breathe in. Breathe out. Chest moves more. Who else? Belly moves more. Okay. We are all different. They both should be moving the same, as well as your rib cage should be opening when you breathe in. So you should be feeling it here, 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 and in the pelvic floor. We should be feeling it all over, right? 360-degree movements. That doesn't happen with most people. So typically, what I have to do as a therapist is see how my patient is moving and breathing when they come in for day 1. If they're not having any movement happening here, guess what we need to do? We need to work on getting that belly moving. If they're not having movement here in the chest, we need to work on that. That is a part of the treatment plan. And this, again, affects your bowels. Because if you're not breathing well, you're not going to be able to poop. What you're going to do is get on that toilet and strain to try to get everything out, and then you're doing yourself a dysfunction, right? Because you're pushing on muscles that are not supposed to be pushed on. Those muscles are supposed to open, and poop should come out on its own. We should not have to sit and strain, okay? So What should our posture be doing when we are sitting on the toilet? What do you think? Legs up. All my young people are gone. Okay. No, there's one right here. Would you like to volunteer? No? Yeah. No? Okay. All right. I am going to turn this around. Can y'all see? I don't even know. Let me see if I can come up. This is called a squatty potty for those who don't know, okay? So, typically what should happen when we are sitting on the toilet is our feet should be up, so the feet elevated, meaning your knees are higher than your hips. So this angle should be an acute angle when we lean forward this way. We're able to open up what's called our puborectalis muscle. It is the muscle that opens and the poop comes out. We don't have to sit there and push and strain. We should be doing the deep breathing like we just talked about, right? Inhale through your nose, exhale through your mouth. If you are constipated, what I tell my patients to do is do something called huff. It's a huffing method, right? So you put your hands on your tummy, and when you breathe in, you exhale out, and when you do that, this pushes your abdominal muscles out, and it pushes the pelvic floor muscles down, but you're not straining to get it to happen, right? So think about if I were blowing bubbles with a bubble wand from Dollar Tree, whatever. You breathe in, you have a pinwheel. You blow out. When you blow out, those pelvic floor muscles are relaxing and dropping, and it allows the kids to be able to poop. It allows adults to do the same thing, right? So I want y'all to sit forward for me. I know your knees are not higher than your hips right now, but if you were, elevated at home, your knees would be higher. I want you to breathe in through your nose. Feel that belly poking out when you breathe in. Do you feel that? All right, exhale. We're going to try it again for those who didn't feel it. Inhale in. This time when you exhale, you're going to say huff. Huff. Now, when you said huff, did you feel your belly muscles push out a little bit? Okay. That's what you want to do when you're sitting on the toilet. Okay? So you might be making all kinds of noises when you're sitting in the bathroom now. And your spouse is like, what is happening? That actually helps for people who have bowel dysfunction, okay? Now, we talked about breathing, we talked about posture, hydration. How much water should you be drinking? Half of your body weight in fluid ounces is how much you should be taking in. So if you weigh 200 pounds, you're not going to drink the same amount as a 300-pound person, okay? Or a 100-pound person. Half of your body weight in fluid ounces is what you should be taking in. 60% of that should be water, right? We drink other things sometimes during the day, but half of your body weight, okay, in fluid ounces. And then increasing your fiber. So we should be, as adults, mostly adults in here, should be between 20 to 25 grams of fiber every day, okay? For kids, they should have, however old they are, plus 5 grams. So if they are a 5-year-old with constipation, they would have how many grams? 10 grams, yeah, okay? So that is what I wanted to point out about constipation. Any questions about constipation? Yes. Half of your body weight in fluid ounces. So if you weigh 160 pounds, I'm just gonna say 80 ounces. Mm-hmm. And 64 ounces? Yeah, that was kind of, we were told growing up, for me, you should have 8 to 10 glasses of water every day. But that's for weight. Yeah, you can't, a person who is 300 pounds is gonna need more than those 8 to 10 glasses, right? You can't have the same for each way. So that's kind of what the research says is half of your body weight in fluid ounces, and then 60% of that should be specific to water. Does that make sense? So fluid total is half of our body weight in fluid ounces. Yeah.
I have, but I'm very susceptible to dehydration.
Yes.
I golf a lot.
Okay.
So you were saying half my weight.
Mm-hmm.
What's your weight?
So, and then you can increase it the more.
I'm 220.
You're 220. So half of that, yeah, 110 ounces. That's more than 64. Do you see? Mm-hmm. On a regular basis. Especially if you have problems with constipation. Does this make sense? So we're talking specific about constipation. If people are regular and they're coming in to see me, usually they don't have, let me not say that. If people are already regular with their bowels and not having this problem, we're not necessarily having this conversation. We're having this conversation now because I don't want you all to be constipated, and for those who are constipated that's not talking about it, they know what to do. Does that make sense? Okay. So, how do I know if I have urgency? This is some of the things that you may say. I always have to go. I can't hold it. I plan my day around the bathroom. I know where all the exits are. I know where all the clean bathrooms are. These are those people. And if you're having these conversations with yourself or telling this to your brother, sister, or whomever, you may have a pelvic floor dysfunction and need to have that checked. Urgency triggers. These are things where you're hearing the water faucet running, or you're hearing the shower going, or you're putting the keys in the door and you're like, I really gotta go to the bathroom. You see the toilet and the pee starts coming already just by you watching the toilet, right? Or you're riding in the car and you're trying to get to the next exit, right? And then that's a trigger for you. Sometimes even riding in the car going home and you see the garage and you're like, whoo, I gotta go to the bathroom all of a sudden. Or cold weather, sometimes that's a trigger, or sometimes just seeing the sign of a bathroom will make you wanna go. If you're having those issues, you probably have urgency and need to see your pelvic therapist, or at least talk to someone about it. We talked about this a little bit. It's not always that your muscles are tight. Sometimes your muscles are weak, and sometimes they need to learn how to relax. So tight muscles is not something that you want in your pelvic floor. And I'm saying that because most people think, I want to be tight. I'm like, yeah, I need to be. And I'm like, no, there needs to be a balance. You need to be able to relax as well as strengthen those muscles. And if you have too much of a good thing is a what? It's a bad thing. So you need to be able to do both. And we talked about the urgency being, we haven't really discussed so much of it being a loop yet. But let me tell you why we call it an urgency loop. It's a loop because, again, the bowels affect the bladder. If the bowel is not checked, it's going to be very hard for that bladder to gain control. Those things then affect your muscles. So that's going to tighten your muscles up or make your muscles weaker. And then what operates off of that is your nervous system. So if your nervous system is very upregulated, you're stressed all the time, you're not sleeping, you're not breathing well, you go to the bathroom, you're straining, that is then going to impact the bowel, which then affects your bladder, which then affects the muscles, and again, the nervous system. So what do we need to do? We need to get all of this operating in harmony. And so where do we start when we have urgency? Where do you think we start? Do we start with the muscles? Do we start with the nervous system? We start with the bowels, okay? Before we even start with the bowels, where should we start? I heard a few things here. Yes, what you're saying is true, but I want you to really think about the nervous system. And the nervous system, because that's gonna play a huge role. If I have urgency and I gotta go to the bathroom and I'm like, whoo, I gotta get in there real fast. If I just stop and breathe, you're activating your parasympathetic nervous system. And that's gonna help calm things down immediately. Yes.
The theory about children, after eating, they want to go defecate right now.
Yep.
What's that theory? I just don't understand.
Yeah. So your bowel likes routine, And for most children, within 5 to 10 minutes after they eat, they have to go. And to be honest, it should be that way with adults as well. When we take in food, we should be able to get out the food from the meal before, the day before, or however long it's been. But with kids, it happens so quickly, and it's because the bowel loves routine. A healthy bowel loves routine. When that bowel is compromised in some type of way, the routine is not there at all. Like some people will be like, I haven't been in 3 or 4 days. I'm like, whew, okay. I mean, I've had patients, they'll go 10 days without having bowel movement, and it's an issue. It really, really is. Yeah, great question. Anybody else? Yes. I'm sorry.
Sometimes I'm asking for myself and for fellow teachers too. Sometimes as teachers we have to watch these kids, and you get a little half an hour somewhere in their call when they're off doing their thing. And if you don't go when you're supposed to go, then you hold it up, and then you have to go collect the kids, and before you know it, the day's ended, and you still didn't go. It has happened to me more than once. What dangers, if any, does that pose to your pelvic floor?
Did everybody understand her question? Yes. And that's a great question. We call that teacher's bladder and nurse's bladder, because their bladder, your bladder will continue to what we call grow. And your bladder is like a balloon, right? If you put water in it, you dump it out. You put it in, you dump it out. So these are the people with frequency. You put it in, you dump it out. That bladder's gonna shrink, and you're not gonna be able to hold as much. So now every time you put something in, it's like, whoo, I gotta go to the bathroom. So the opposite of that is nurses and teachers' bladder. That bladder holds and holds and holds and holds, because you keep telling the nervous system, no, I'm not gonna empty. No, I'm not going to do it. And so the receptors inside of the bladder then start to disintegrate. You don't have them there. I mean, they're there, but they're not activated. So then you start getting something called urinary retention. That is the downside, because you really don't see the retention start until you reach menopause and you get older, and then now all of a sudden you're having problems going to the bathroom. It's like, I want to go, but I can't go, right? So I go to sit down on the toilet, but nothing is coming out. So then that starts getting into more urinary hesitancy, and then you have problems with retention. So it's the complete opposite of urgency, right? So what should we do if we have to go? Go, maybe even ask someone if they can come in and sit in for us. You are not alone, because when I tell you, so many people have that issue. Teachers and nurses and even therapists can be the same way, because we work with patient care, and they put you on the clock, and it's like you always got to be on. It's really hard to go, but sometimes you just have to take back control and just be like, no, I'm going, or schedule somebody to come and relieve you. Anybody else?
So for those that are in those kind of demanding professions where you can't just go, is it a bad thing to train yourself to like go once or twice a day, like at the beginning of the day or the end of the day? Because once I sit with the client, like I can't tell a client, sorry, I need to go use the toilet. You know, we're in it.
So let me ask you this, what about in between clients?
What's that?
Are you able to give yourself space in between?
Yeah. In between clients, I'm doing notes. So at the end of the...
There it is. There it is right
And then
there.
insurance, they audit, you know, so I have to do my notes, I have to chart, you know, and so when the day is done, I go use the toilet, or before I start, I use the toilet. Either one or
Right.
two. So,
One or two.
So yeah.
Let me ask you this, in a 24-hour day, are you using the bathroom at least 5 times in that 24-hour period?
5 times? That's a lot. I don't have time for 5 times. No.
5 is minimum. really they want 6 within a 24-hour period. That's norm. In a 24-hour period, you should be going. If you're drinking like you need to drink, you will empty. If you're not drinking, you're not gonna empty because there's nothing there. But if we're doing what we need to do, I'm telling you, it will make you go, and you will have to tell that client, I'm sorry, give me 2 minutes so that I can go.
Go to the bathroom.
Go. Well, we either pay now or we pay later. That's the thing. So we have to really love yourself enough to change now. Yeah, if you can.
Real quick, because I'm in that same field, and I will not do a note because I have to go to the bathroom. Or I will text my client in the waiting room, give me 5 minutes. Because I'm not going to suffer at 65.
He has a question in the back. That's right. Mike.
I'm asking this question for someone else.
For someone else. Yes.
What if this individual only would drink like tea and no water? What are the...
Woo. That's going to be a problem with urgency. It can lead to leakage, and it can lead to overactive bladder. And the reason is because, especially if the tea, now let me ask you this, is the tea caffeinated or yeah. So caffeine is a stimulant, and it's gonna make that bladder go, 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 go. So yes, you are gonna have to go to the bathroom more often if you're drinking caffeinated beverages. And sugar. That's gonna make you go more often too. It's just, it can lead to overactive bladder. So with you being having to go all the time, you just gonna have to go. That's
The person.
somebody. Right. Yeah, you can damage yes, you definitely can damage your kidney, but not just the kidneys, the whole entire system, right? So you want to make sure that you're drinking water. And I even tell my patients who love to have coffee, I'm not necessarily a coffee drinker, but I can tell you, if you're drinking 2 pots of coffee, yeah, you're going to have to go to the bathroom. You're going to have urgency in the middle of the night. You're going to be waking up, going to the bathroom multiple times. Those things happen. Even with caffeinated beverages, it's the same. So it can disrupt your sleep. It can disrupt your, just as a whole, you don't want to do that. You don't want to do that to your body. Yep. Anybody else? Now, yes. When it floats, usually it's too much fat in your diet. Yeah, yeah. It should. It should sink. Yeah, not float. Too much fat. All right. So that's a great question. Let me ask you this, because we're supposed to be for an hour, and for those of you who need to leave, I do have more information, but I could go on and on and on. I'll tell you some of the things that I was going to talk about is menopause, it's like keep going, and andropause, I don't know if y'all heard of that, and then sexual dysfunction. So it's up to you whether or not you need to leave. You have, you're free to be able to do that, but I have more information. I just don't want to hold people hostage. If you said an hour, then I want to respect your time. So are y'all good? If I can try to get through these in about 10 minutes, 15? Oh, okay. Have a question? Okay.
What are some of the sources of fiber that you would suggest?
Oh, love that. So we know fruit, all fruit is good, but the ones that I usually tell people who have problems with constipation is going to be the peas for sure. So pears, peaches, prunes, plums. Apricots are also good. Figs are great, but any fruit is wonderful. Vegetables, cruciferous vegetables, anything crunchy is gonna make you go. Seeds, you wanna think about the pumpkin seeds, chia seeds, berries. You wanna think about all of those things. Those are great. If you look up on Google, soluble and insoluble fiber. It'll give you a whole list of all the different ones, but those are the ones just off the top of my head that I usually will recommend. Yep. Anybody else? Any other questions? Okay, we're gonna move on to menopause. Woo! So this is a wonderful time of life because we're gonna thrive through this. We're not gonna allow it to overtake us. We're gonna overtake it, okay? So with menopause, menopause is a moment in time. I never knew that it was only for a moment, but we have perimenopause, we have menopause, which is the moment in time, and then we have postmenopause, okay? So menopause is when we still have a cycle. Sometimes it's present, sometimes it's not. Menopause happens, that was perimenopause. Menopause happens when you have gone 12 consecutive months without having a cycle, okay? At that moment, it's been 12 months. At that moment, you are in menopause, and after that, you're in postmenopause, okay? And you'll be there the rest of your life. But perimenopause can start in your late 30s. 30s. I didn't say 40s, 30s. So what are some of the symptoms that you have during this time? It's the same symptoms that can carry on through menopause and postmenopause. Some of these are hot flashes, brain fog, moodiness, low libido, vaginal dryness, night sweats, trouble sleeping, joint discomfort, muscle discomfort, pain with sex, irritability, difficulty concentrating, forgetfulness. Forgive us, men. Please forgive us. Dry eyes is even a part of this. If we move on, I want you to see what happens when our bodies begin to deplete estrogen, okay? We begin to have something called vaginal atrophy. This is where the pelvic dysfunction comes into place for our ladies. And men, I'm glad you're here so that you can hear what we're talking about and understand. So when there's a depletion of estrogen, what happens is there is not, if you look to the left of the screen and the right of the screen, so to the left of the screen is going to be a vaginal wall that has, that is non-menopausal. To the right, we have the menopause, right? So you have before menopause, after menopause, and when there's estrogen loss. So before, there is good blood flow to the vaginal tissues, the vaginal lining is thick and it's moist, the vaginal walls are elastic, the vaginal fluid is secreted during sexual activity, and then afterwards, we have a decrease in blood flow. And see how thin the tissue looks, how pale it is. The vaginal lining becomes thin and dry. Vaginal elasticity decreases. The vagina narrows and shortens, okay? And there's less secretion of fluids during sexual activity. So it's not that a lot of women don't want to engage in intercourse. It's just that your body sometimes is not working with your brain. And your body is like, nope, I just can't right now. And it's because of all of the other things that's happening with us hormonally, okay? So when you have a decrease of estrogen, it's going to cause the tissues of the vagina to be thin. They're no longer plump like they were. So now we're doing a lot of the hormone replacement therapy and things like that that doctors are now recommending. But it will lead to sexual dysfunction, okay? And we don't like to talk about it. Especially in the church. We do, and not in the sanctuary. But we should, because it's a part of life. God made our bodies. He made our bodies fearfully and wonderfully, and he knew all of this was going to take place. After sin happened, it's just like for women and for men, it's an uncomfortable place to be. We don't want to talk about it. But my question is, why don't we want to talk about it? Because everybody's going through it. At some point in life, like my grandfather said, if you live long enough, you're going to go through it. Okay? But I do want to point out, it's not always something that we as women can control, but we're trying to do our best because we're going to thrive through it. So here are some of the symptoms. I don't know if you can see that. again, of menopause. Hair loss, fatigue, dental issues. People start having a lot of problems with their teeth. Burning mouth syndrome, breast soreness, itchiness, joint pain, electrical shock pain, right? You feeling like you have numbness and tingling in your hands, waking up in the middle of the night. Like, what? Menopause. Brittle nails, muscle pain, tingling, incontinence, bloating, digestive issues, irregular heartbeat, body odor, panic attacks, allergies, anxiety, depression, headaches, dizziness. All of these things can be as a result of lack of estrogen in our bodies, okay? Now, that was for the women. Here's for the men. Andropause. I'm gonna hear the men say andropause. This is another name for it is hypogonadism. It is a gradual decline in testosterone starting around the age of 40 or sometimes even the mid-30s and continuing for the rest of your life, causing symptoms like fatigue, low libido, reduced muscle mass, and mood changes. The risk factors, again, include aging, obesity, chronic illness, and stress. So I wanted to put these two side by side, where you have andropause and menopause. And I don't know if you all can see that very well, but here for menopause, the woman has forgetfulness, hot flashes, nausea, heart palpitations, irregular periods, vaginal dryness, joint aches and pains. We talked about that. The men, all the way to the right, decreased motivation, lack of focus, low energy, muscle loss, mild to moderate erectile dysfunction. Again, in the middle, which means both of us are going through at the same time, mood swings, depression, headaches, night sweats, insomnia, weight gain, and bone loss. So we're wondering sometimes what's happening in our homes. Why are we not the same as we were when we were in our 20s? You know, when we first met one another. We are all going through hormonal changes. It's not just the women, it's the men too. So that means that we all need to have grace for one another and have conversation about what's happening in our bodies. I think our mates would really appreciate just having a candid conversation, because we don't always get the men and y'all don't always get us. But God loves us all and he wants us to live in harmony with one another. So that leads us to a talk on sexual dysfunction. This looks like dyspareunia. That means painful intercourse, okay, for women. And again, we talked about our bodies having a lack of estrogen, having problems with penetration and things like that, okay? Vaginismus, that means that at one point in time, so it's primary and secondary. So at one point in time, you may have been able to tolerate penetration. Secondary vaginismus is now I can no longer tolerate it anymore. So maybe because of age, menopause, cancer, a lot of different reasons as to why. Weight gain, and then again, vaginal atrophy, right? So here are other sexual dysfunctions that we don't talk about often. Low libido, vaginal dryness, vaginal atrophy, erectile dysfunction. We did talk about that. How 60% of men over the age of 50 deal with erectile dysfunction, and we're not talking about it. What happens is we just stop engaging with our wives or a spouse, and it's like, oh, well, what happened? Well, I can no longer, respond the same way that I used to when I was in my 20s. And so now it's embarrassing for a lot of people, and then they start talking about it. So again, we need to put verbiage around it and normalize the conversation because it's happening, right? It's not just happening to you. I guarantee you, if you go talk to another brother over here or sister over here, they're going through the same thing, okay? Erectile dysfunction, premature ejaculation, right? So that means I'm ejaculating before I reach climax. My wife is still like, okay, and you, what just happened? It is something that occurs with a lot of our brothers, and again, we're not having the conversation to figure out why, okay? So premature ejaculation and then also delayed ejaculation. So you're going on and on forever and ever and you're like, well, now I'm wrong. I just can't anymore. So again, we need to have these conversations, guys, and we need to know Jesus wants us to be able to enjoy one another, okay? As a husband and a wife. God gave us the ability to be able to, let me tell when y'all see this next slide, y'all gonna be like, oh my goodness, God was so intentional, because he was, right? And I'm going to show you all this, if y'all are okay. Are y'all okay?
We okay?
You sure? Okay.
We okay too, we okay.
God made us. He made us this way. All right, so I want y'all to tell me, looking at this screen, what do you think this is? Anybody? A giraffe. Somebody said a giraffe. Yes. Yeah. Just, I'd like for you to tell me, what is it?
I would say A is the clitoris, B penis.
Yes. So what do these have in common? Everything. Who said that? Yes. God made us with the same organisms. Like, that's the makeup of our microbiome. It's the same for women and for men. But for women, okay, here's the part that I love to talk about, okay? Here we have the vulva. All we see is the top of the clitoris. That is it. Do you see how deep the clitoris is? All of this. Do you see that? It is just like a male penis, literally. That is the inside, okay? So this is the outside, what we see. Inside is all that's behind this. So once you know your anatomy and you have reached menopause and you're of age and you're like, I can't engage anymore, there is so much more than just one area that you should be trying to engage or stimulate. I'm gonna allow this for the women who want to see this. Again, this is all we see. But look how long the clitoris literally is. You can pass it around, just make sure I get it back. So, I'll pass this one around on this side. So I wanted you to all be engaged and understand, educated, because of the fact that when we reach a certain age, we feel like everything is all over. And I went to the marriage retreat this year. We had conversation around this, the women did. Remember when? Okay. And I wanted us to really understand how God made our bodies. And we can be stimulated in so many other ways. It does not have to be just one way. But understand, when you know the anatomy, you can go to work on the anatomy, all of the anatomy, not just the one place. And I'm saying that because a lot of times people get very fixated on one thing, one way. And I'm saying God has given us so many ways to learn about our bodies, to understand our bodies. Once we learn, we can share it with our spouse and then enjoy. Okay? So I'm going to go to the next slide while you all are passing those around. And I wanted you to be able to see specifically where you have the penile shaft. I don't know if you can see that. The blue is the shaft of the penis as well as the clitoris. Then the yellow is the crew. So we have the same parts on both. Then you have the green, which are the bulbs. And then the red part is the gland. So you have the glans, penis, glans, clitoris. All of it is the same. That's what I wanted to point out. I wanted y'all to see how fearfully and wonderfully our bodies are made, and God was very intentional about what he did when he created us. So, do we have any other questions? Anybody? I hope that you all learned a lot today. This is something that I wanted to share with you all that's coming out soon. It's going to be called Boss of My Bladder. And it's for people who have urgency, frequency, leakage, and pain. And it's just a book, an ebook that I'm putting together now. And I wanted to tell y'all about it. So in case you're interested in the future to be able to order one of these books, you can let me know, and I'll make sure that when it comes out, you'll be the first one to know. It's only $27. I'm not taking any money. I'm not doing any of that today. I'm just telling y'all what is actually coming. So you can learn some of the things that I've been talking about today, how to treat it in that book, okay? So thank you all so much. What is Tree doing? Thank you so much for attending this workshop. And if you all have any other questions, did y'all break something? What did y'all break?
They passing around the clitoris.
Oh, okay. And the both grown people. They don't know what belongs to them. See, we need a whole class just on what belongs to what. Well, see, that's another class to have. Yes. All right. And so, if you want to stay connected with me, this is my social media, all of my IG, my email. Take a picture of it, feel free. I also have some cards up here if you are ever interested in having any consultations. I do things virtually as well. So I have enjoyed my time with you all, and I hope to come back again. I want to make sure everybody's good. Anybody have questions about anything? Yes. Hemorrhoids. Yes. Is it a part of it? Yes. Oh, absolutely. So hemorrhoids are the blood vessels inside of your anus. A lot of times they are very irritated, and then they swell, and then they come out of the anus protruding. And so what happens, that usually occurs when there's been a lot of straining going on and people are not breathing well when they're sitting on the toilet. But if you practice putting your feet up, remember, and doing the remember the huff, where the stomach is going to literally come out, it will allow you to manage your intra-abdominal pressure better, and then you can reduce those hemorrhoids. But for people who have hemorrhoids, don't ask me. There are certain things that you can do for your hemorrhoids, okay? Does anybody use sitz baths anymore? It's too much work. If your hemorrhoids are bad enough, I promise you, you will do it. But it's literally, you can purchase a sitz bath from like Walgreens or Walmart. They have them, you put the warm water in, sit on the toilet, put it on top of the toilet, and you sit in it and just kind of let your bottom soak in that. That usually helps. Ice will help as well. And then Tux, he said stay away from spicy food. Okay. Yeah, so it's something that a lot of people literally deal with, and some people have had to have them removed surgically. Like, it's a thing. And I mean, I've seen it like cabbages growing out of people's anuses. It can get to a point where it's really bad. So, but yeah, those are some of the things off the top of my head that I can talk to you about. Yes, you had a question?
And Dawn has a question.
Okay, is there another mic? Okay.
She got a question. Well, she don't have a question.
Oh, Dawn.
I was gonna ask about the footstool thing. We want to have one of those just for bowel movements?
Yes.
We're saying, okay.
Yes, this is called the squatty potty, and they come in different lengths and sizes. So there's 7 inches and then 9 inches, depending on if you have a tall toilet or a short standard size toilet. Yeah, you can get a big step stool. I've had some of my patients turn over trash cans and put their feet up. I've had some people use books, so you can get very creative.
One of the things that I like to take my kids' phones when they're going in the bathroom because they're sitting too long, and that leads to hemorrhoids too.
Yes.
So
5 minutes. 5 minutes. is as long as I usually tell people that they can sit. If you're sitting longer than 5 minutes, you need to get up and keep it moving. Do not sit longer than 5 minutes for kids.
Yeah,
No.
adults too, because even truck
Adults-
drivers, they tend to have a lot of hemorrhoids because you're sitting so long.
Yes,
People who,
5 to 7 minutes for adults, 5 minutes for kids.
Yeah.
Yes.
Yeah.
So, and when you're sitting, you need to focus on breathing, not your phone, not reading a book. People take morning watches, remember the morning watch? They leave it in the bathroom so they can just sit there and read. And I'm like, but you should be concentrating on breathing so you don't have to sit here for a long period of time, because if you do, you will get hemorrhoids. Absolutely.
Wait, I have it was a question about, last question, man. There was a question like, how do you get to the backside of how do you get to the other?
That's the inside of your vagina.
I know. I guess the real question is, how do you stimulate the entire organ?
You use your fingers over the spongiosis on the outside. So you're on the outside of, so this is on back, first of all. It goes like this. So if you are stimulating, remember this is your urethra, vaginal opening. So if you look along the side of where the clitoris is, you're literally on the base of the skin of the vagina. So the labia minora and labia majora are open, and you're here on the outside. That stimulates the full length of the clitoris. You see that? Does that make sense? Okay. Not just the top.
Question.
Go ahead with the question. Somebody had the mic. Okay, sorry. Yes, ma'am.
Okay, in regards to menopause, there are some herbal things that you can recommend for people to use. I think cohosh was one.
Black cohosh.
What are some herbal things that people can try for menopause?
Woo. Okay. Come back to me so that I need to find that. I'm gonna find that for you. Give me 1 second. But black cohosh definitely is one. I just need to get the list. Hold on. Somebody else had a question while I'm trying to pull this up.
I just wanted to say what I do in the morning before I get out of the bed. If you learn how to breathe in and out, roll your stomach, that'll help you use the bathroom. Roll your stomach in and out, and it'll help you use the bathroom.
So I want to add to that. If you go to Google, you can Google the I Love You massage for your abdominal wall, and it also will help you to go to the bathroom. So she's saying roll your stomach. You're saying move your stomach in, out, in, out. But you can literally use your hands to roll from the right side of your colon. So this is your ascending colon, transverse colon, descending colon, rectum. And so you're literally going in a full circle here. And you can do that 10 times around, okay? And then you literally will just go 10 circles, move up, 10 circles, move up, 10 circles, move over, 10 circles, move over, 10 circles. So you do the big one, and then you go back to doing the individual ones. It's called the I Love You abdominal massage, and you can find that on YouTube. Hello. Okay. So some of the herbs for menopause are what we said. Black cohosh, okay. Valerian root, which helps with insomnia, so that helps you to be able to sleep better. Chaseberry helps with hot flashes and anxiety. Red clover and maca root. Those are some of the main ones, okay? How many take other things, like anything else for menopause? Yes. Yes, I see your hand. Yes, HRT, yes, hormone replacement therapy. A lot of people are doing that now. And then that's for people who want to be able to replace their estrogen, testosterone, progesterone levels. But then these are some of the things naturally that she was talking about. So I can't speak to one or the other. I'm not saying do this or do that. I'm saying you can do this and do that, or you can do nothing, or you can do this or do that. You can do, I just can't tell a person what to actually do because that's not my area. But please see your OBGYN. They will talk to you about this in depth. How many people have started HRT? Anybody in here? Okay, yes. Yes, so that's why you're speaking to it. Have you noticed a change or difference?
I did notice a change, and one of the things that she told me.
Give her a mic, I'm sorry. There you go.
One of the things that she told me about hormone replacement therapy is that it was shunned before because the medication used to be processed through your liver, whereas now it's through your skin because the estrogen is through a patch that you put on. So it doesn't have as many risk factors for, the cancers and things like that, which is the reason why most people didn't want to do it before. So, but it has been helping a lot. I can actually sleep at night, so it's amazing.
Okay.
Okay, so about this patch, does it fall off?
It does not.
Because I was scared of it. Okay, anybody have a question?
Just curious, as we age, we may not move as much. How does exercise, walking, movement, swimming
Yes.
improve or
Yes.
help our floor, our pelvic floor?
It helps all of it. It's gonna help your heart, it's gonna help your brain, it's gonna help your sexual function. Movement is everything. If you look at the American Heart Association, they say, the research says 150 minutes a week is what's recommended for an adult. And especially if you have the propensity of a lot of cardiovascular disease in your family already, which a lot of us do. Strokes and cardiovascular is like really, and diabetes. Those are like the top 3 amongst African American descent. And so we want to make sure that we're moving as much as possible. So that definitely will help. And vitamins. Vitamins. Black girl vitamins? Okay. It's literally called black girl vitamins. That's the name of it. It helps with a lot of it.
I have a cycle question.
You have a what?
A cycle question. A
Silent?
menstrual cycle
Oh,
question.
cycle. Uh-huh.
I don't know where it will fall into the whole pelvic thing because I was weighing it in the balance. You mentioned earlier about the amount of time that you should spend sitting down on the toilet. So like 5 minutes or something like that. I want to, mine is both that and menstrual because I don't mind putting myself out there. That's me. So it doesn't happen all the time, but once in a blue moon, for want of a better phrase, I'll have a point in my cycle where my tummy hurts. I'm not generally bothered by pain. Little, maybe a week or so before, or 2 weeks before. But then, very rarely, there comes a time when I'll be stuck in the bathroom for anywhere between 1 to 2 hours. With my tummy hurting, so like if I feel that kind of hurt coming on, it will hurt so bad and I just keep going and going and going and I want to get up, but I can't get up because as soon as you have a whole tissue in there or more, I just keep going and going and going, and then when I think I'm finished and I start walking up, I gotta go right back. So I know when that happens, which it doesn't happen a lot, but when it does happen, I just keep going and going and going, and the hurt is not going away. If I was to compare it to something, I'd compare it to something just being grated and squozen at the same time. I don't know what that is about.
Have you spoken to your OB about, or OBGYN, really, OBGYN? I will ask you that question, and then I'm going to follow up with, if you have spoken to the OBGYN, did they refer you to a urogynecologist?
Never been to one, never had one.
Okay. I would start with that. I would start with your OBGYN because that is not something that is considered normal when it comes to having to be there for 2 hours. Something else could be going on that you don't know about. And and I don't want to scare you or anything like that, but I do want you to at least have the conversation with them about what it possibly could be. And if they say, oh, well, you're fine if you've been doing it for this many years, da-da-da-da-da. But I would be curious to know if you have something else going on, like endometriosis or something like that. I don't know. But they would have to be able to tell you more of that. That's kind of out of my scope of practice, but I would have the conversation at least with the OB. Yep. Somebody else? You had a question? No? Okay. Y'all are wonderful. This is a great group. Thank you all so much for your questions, and if you want to talk to me afterwards, I am here, okay? All right, thank you.
Thank you, Dr. Heath, for your information. Again, the QR code is up there. She does have some. This is my phone. That's mine. I know we got the same one. But if you want some more information, there's a QR code here. She does do virtual consultations, because we're all in the state of North Carolina. She's licensed here. So if you want something more in-depth or more personalized, please reach out to her. We need to be more mindful of our bodies so that we're not scared of our bodies, okay? And if you have any more questions that you think of, because if you're like me, you're gonna think of it in the car, and when you get home, and tomorrow, just give her a holler. You have her information up there. But if do we have any announcements for the church or anything? Give it up for Dr. Heath's husband, Daniel Anthony. Anthony, that's my phone. Anthony, that's my phone. Same phone. All right, any announcements? I know we're having the mental health event on my birthday next Sunday. I don't know where it is. Is that 10 o'clock at the Family Life Center? First Lady, then Jody. Oh yes, May 16th is when we going into the community. Is that? Okay, so on the 16th, we're having an old-fashioned social after we go out and serve the community. Jody, you had something? Okay, we got one more announcement back here. I'm getting my steps in.
May 23rd, Women's Ministries Day. The colors are purple and pink. You should be hearing more. And there will be a program immediately after lunch. However, there's a warning to the parents. Some very sensitive topics will be discussed. So she's requesting 12 and up, but even for those age groups, if you don't want your child to be in that conversation, and if you want to know more, just ask me and I'll tell you specifically what it is. Nothing really bad, but if you haven't talked to your child about these things, you might not want them to be in the audience. And there will be something else for them that evening.
Any other announcements? All right, let us stand. Let's repeat the mitzvah. May the Lord watch between me and thee while we're absent one from another. Amen. Okay, trivia question. Do y'all know where that came from? And who was having that conversation? Who had that conversation? Who had the mitzvah conversation? Say it again.
It was Jacob and Laban.
Read your word. It's in Genesis. It's in Genesis. It's been